The Cannabis Conversation. A European perspective on the emerging legal cannabis industry.
Welcome to the Cannabis Conversation with Anuj Desai, where we explore the new legal cannabis industry by speaking to the professionals that are helping to shape it. So, we've made it to the end of 2020. I hope you've all enjoyed it as much as me. Been a huge barrel of laughs, obviously. But in all seriousness, it's been extremely challenging in many different ways for different people. We're all in the same storm, not in the same boat, is probably the best phrase I've heard all year. Despite it being very tough at different times during the year, it does feel like we have some positive hopes going into 2021. And whilst we do have some positive hopes, it's given me cause to reflect on some of the things that I've been reminded to appreciate more over the course of the year. The three biggest things for me on a personal level have been, firstly, how important my relationship with my kids is. Let's be fair, homeschooling was no walk in the park. Secondly, how important the outdoors is to me. It feels really cliched, but when you're told you can't do something, it really makes you want to do it. And finally, just how important music is to me. Putting on some old tunes has been a great reminder of better times. But on the cannabis front, and on a personal level, I always say one of the hardest things about this industry is finding the right people to work with. I suppose it's the same with most industries. I've definitely made some mistakes and I've wasted some time and gone down a few blind alleys. But actually now I really feel like I'm finding my people. A very strong crew of talented and trustworthy people who are doing things for the right reasons. So some of you may have seen my post on LinkedIn a few weeks ago, but I've gone back to what I know and I am now acting as a lawyer for a number of clients in the cannabis and CBD space. I'm helping some really great businesses in the UK and Canada with a variety of corporate and commercial advice. So if you're in need of a UK lawyer, please do get in touch. I'll be talking a bit more about this in the new year. On a macro scale, though, cannabis has enjoyed a strong end to the year. Amongst the bizarreness that is going on in the US, cannabis was a clear winner in the recent elections. We also had a very positive result in the Cannavape case, which has been a great relief for the CBD industry in Europe. And just last week, we had a historic and symbolic movement at the UN level, and that's what this week's show is about. But before we get on to that, I'd just like to say a huge thanks to all of you for listening. I've said it a few times, but this is definitely the best thing I've done professionally. I'm still getting a huge amount of enjoyment out of this, even 2 years in. I'm learning so much and my fascination just grows with each new person I meet. So thank you so much for your support and I hope you've found the shows useful. I'd also like to say a big thanks to my amazing social media manager, Rebecca, who has been invaluable in all her contributions and help and support over the last couple of years. Thank you very much, Rebecca. Please stick around after the show as I have another quick announcement, but without further ado, let's get on with it. Enjoy. On today's show, I have Kenzi Riboulet-Zemouli. Kenzi is president of FAAAT, which is an international drug advocacy and research organization. He is also an advisory board member of the European Industrial Hemp Association and is a leading researcher on international drug policy. Kenzi, welcome.
Hello. Thank you for the invitation.
Real pleasure. How are you doing today?
Great. And you?
Good. So there's been a really big week or two for sort of the international drug policy scene. Loads to talk about. Let's get a bit of background on you first, though. Why don't you introduce yourself and tell us a bit about what you were doing before, how you got into drug policy research, what are you doing now?
Well, maybe I guess the first thing to say is that I was born in France and then I moved to Spain, more precisely to Barcelona, Catalonia. And I moved here because of drug policies generally, cannabis policy in particular, but I moved to Barcelona thanks to drug policies. In particular, cannabis policies, but not only. Catalonia is a very vivid place for the reflection around these important issues. I was trained in motion picture, the techniques of processing and developing, and of analogic motion picture. So no relation with drug policy. I just had a passion for this topic, and I was in France at that moment, and France is still a very conservative country on drug policy, even though they finally started an experimentation on cannabis recently. But apart from that, it's still quite conservative. So I realized there was a need for I guess, some more brains activating around these issues, and cannabis in particular, especially in France, which is one of the country where most people consume cannabis on the continent in Europe. And so seeing that issue needed involvement, I started to involve. And at some point, I decided to make the move in my life to dedicate my career to working on this issue. And at that moment, I also moved to Barcelona. And I got connected with this network. Here in Barcelona, there is a very interesting international network of activists working on drug policy, not only cannabis, but also psychedelics, opioids and opiates and harm reduction, etc., etc. So very interesting. That got me connected with other people working on these topics in the USA, in Europe, in Switzerland, and in other continents. And from there, I got to Vienna. Vienna is a city in Austria, in the middle of Europe, and it's one of the 4 headquarters of the United Nations. The most well-known is obviously New York, but they also have headquarters in Vienna, Austria. It's where the United Nations Office on Drugs and Crime is located. And so I started to attend their meeting and realize the importance of the policies that they manage from Vienna.
Wow. Okay, there's a lot there, isn't there? Yeah. So clearly your work covers more than just cannabis. How much does cannabis of your 100% of the week, how much is cannabis part of that?
Well, in the last 5 years, I've been really focused on that big news that everybody saw last week in the news, or a couple of days ago, the scheduling of cannabis. So I've been really focused on cannabis almost 100% of my time in the last 5 years, and precisely on the international scheduling of cannabis, and more precisely to get cannabis out of Schedule 4.
Right. Well, brilliant. Well, that's what this show's all about. So we'll get to talk about that in a little while. Before we do that, I always like to approach these things in a bit of a 101 way. And obviously we have to think about how much time we have to talk about it. So if there's any way that you can give a very simple overview of kind of international law in relation to cannabis, I'm going to put you on the spot.
Yeah, it's really difficult. I mean, it's a challenge, but it's good to try every time to make it more simple for one of the most complex area of international law, what we call drug control. Cannabis is regulated internationally by a series of treaties on drug control, the drug control conventions. And they are managed by the United Nations in Vienna. And these treaties, heavily influenced by the USA in the 1950s, 1960s, impose to the countries that have ratified them. So it's almost universally ratified. It's about almost 190 countries have ratified the different drug control conventions. And once you ratify it, you have a sort of basic framework of national drug law to implement in order to comply with the treaties. And what the treaties say, it's again very complex, but we can mostly maybe say it shortly in this way, that the treaty, we have to understand the title of the treaty is very important. Drug Control Convention. They control drugs. It's not a treaty to prohibit drugs. It's a treaty to control drugs, and you have to understand drugs in the meaning that it had in the 1960s, which is a pure equivalent to medication. So I like to call these treaties the framework convention for the regulation of the pharmaceutical sector, because objectively that's what they are doing. They establish a different set of policies and regimes, legal regimes, that countries have to comply with in order to provide the availability of these drugs for medical and scientific use. And then they recognize that these drugs have other uses, in particular what they call industrial use, which is exempt. It's just not regulated by the conventions. So you can make an industrial use of any drug, basically, including morphine, including cannabis. It's known as hemp. There are a lot of drugs that we can use in industrial processes or to make goods and products whose purpose is not to get high. Even though these drugs are scheduled, it's a case for cannabis and hemp. You can make, even though you can get high with cannabis, you can also make cannabis hemp products with which you will not get high. So the treaties control medical uses, they exempt industrial uses, and they ban what they call abuse, which is what we understand as being recreational use. So this is the framework, the political and legal framework imposed to every country that have ratified these treaties, provide access and availability to the drugs, to control drugs for medical uses, do whatever you want with industrial uses, and prohibit abuse. So that's why we have basically worldwide very similar national drug control laws, and we have the same substances being considered as drugs in every country. That comes from this international harmonization that has been pushed by these drug control conventions.
Right, fantastic. And that's a really good summary of and distinction that it's control specifically. And so what are the actual names of the treaties that we're really referring to here?
So they have names that are sometimes tricky because they look a bit the same. We have the Single Convention, passed in 1961. So the Single Convention classifies and controls what they call narcotic drugs. The term narcotic drugs has no real meaning. It's just sort of fashion terms at the moment. It doesn't, narcotic usually is understood as something that makes you sleep. It's not necessarily the case. For instance, cocaine and a lot of stimulants are controlled in the 61 Convention, the Single Convention. So it just has this nickname of narcotic drugs. And then there is the 1971 Convention, 10 years after, this time on psychotropic substances. And likewise, psychotropic substances had just no particular meaning. It was just to differentiate it from the narcotic drugs. But the case of cannabis is really interesting because cannabis was scheduled in the 1961 Single Convention. It's still the case. But then in 1971, THC, the compound, the molecule, was scheduled in the 1971 Convention. So theoretically, THC is at the same time a narcotic drug and a psychotropic substance, which doesn't really make sense. But international law doesn't always make sense from a pharmacological or scientific point of view. But from the point of view of control and political interest, it does make sense.
Yeah, and I think that's also very clear, isn't it? There's a lot of politics involved here rather than evidence. And so what are the main organizations? Obviously, the UN is involved, but are there any other international organizations that work together around the treaties and enforcing them, etc.?
Yeah, there are four what we call treaty mandated roles in the treaty, in the conventions. The first one is the UNODC. I mentioned it before, the United Nations Office on Drugs and Crime. It's basically the secretariat of the treaties. They act to do all administrative matters. We have the Commission on Narcotic Drugs, which is a delegation of 53 member states, 53 countries that are at the same time members of the UN and that have ratified this convention. On a rotating basis, they integrate this Commission on Narcotic Drugs, or CND, and that's the main legislative body that takes decisions on international drug policies. We have the WHO, the World Health Organization. It has a very narrow mandate in the convention, which is to provide scientific assessment justifying the scheduling of substances in this or in that schedule, or justifying not to schedule certain substances. And finally, we have the INCB. It's a strange, sui generis sort of international organization. It's not really a UN entity, contrary to the others. It's a bit its own kind, let's say. It's the International Narcotics Control Board. And they are in charge of really monitoring the trade, the legal trade in narcotic drugs and psychotropic substances. So they're in charge of quantifying and tracking the sales and the import and export in different drugs for medical uses and research. So these are four bodies.
Yeah. And so would the INCB be kind of involved in the emerging cannabis industry that is now happening?
The INCB is involved. They are tracking legal trade, and they have always been. And they are currently preparing guidelines for member states for compliance with the International Drug Control Conventions. The problem is that it's not clear that this is their role to establish such guidelines, or at least maybe they should not do it alone. They should maybe do it with WHO, with scientists, or with other institutions, and certainly in collaboration with civil society and hearing patients, hearing physicians. hearing, drug control administration, but they are a bit going in sort of freestyle mode. And they have decided to issue these guidelines on cannabis that will be issued next year, 2021. Every one of these 4 treaty bodies is trying to make his own room for having a place in the discussion on cannabis policies internationally. And that's not very clear if they should or not.
Yes. Okay, there's a whole lot there, isn't there, on sort of self-serving organizations. So I think you mentioned at the beginning that virtually all countries are signed up to this, or a very high percentage. If you're a member of this treaty and you have ratified this treaty, rather, you're a country that has ratified this treaty, but then you don't enact the laws domestically, or you reverse the laws. So, for example, Canada, Uruguay, some of the states in the US, are you then in contravention of that treaty? How does the organizations treat those countries?
So it differs. The INCB has a very conservative approach and has said from the beginning, even before, I've been saying since the 1990s, please don't, regulate recreational use because that will contravene the treaties. That's one interpretation, certainly not exactly the one that has the other institutions. The UNODC is more wait and see, and the WHO is just focused on medical uses for the moment. And for the rest, they just, promote prevention and harm reduction, regardless of the substance, be it tobacco, alcohol, heroin, cannabis. It just make prevention. And if the people still after the prevention want to use the substance, you make programs to reduce the actual harms created to these people, period. So saying that it's in contravening the International Drug Control Convention is just one opinion among other, one legal interpretations. What we have to take into consideration is that international law is not composed of 3 treaties. It's composed of 3 treaties among many others. And there is what we call hierarchy of norms inside of international law. And at the top of this hierarchy, we find the Charter of the United Nations. And just below, we found what we call the Human Rights Charter, which is a set of different human rights instruments, which are above the convention. And in case of conflict, if you have a specific disposition of international drug control law that conflicts with international human rights law, human rights prevail. And that's clearly the case for that the approach that Canada or Uruguay have adopted. They say, maybe we are not compliant with this particular provision of this particular treaty, but it's a principled non-compliance. We do not comply with this particular sentence because not complying with this allows us to comply with many other, parts of international law, including the right to privacy, the right to health, the right of indigenous people, etc., etc.
Right. Okay. So they're using a different legal argument to explain why they aren't listening to that particular aspect of the convention.
Exactly. In international, in law, it's generally, but in international law even more, it's always a matter of interpretation and of who defends better, his particular or her particular interpretation of treaty or a piece of law. There are, other interpretations on my end. I believe that the abuse that the treaty are banning is not necessarily equivalent to recreational use, to adult use. Abuse is abuse. It's an excessive use, and use that has gone too far, and use that has become harmful for the person or society. It's not necessarily recreational use. Recreational use can be non-problematic and not abuse. So, there is also a way to say, because these uses are not defined, we have 3 kinds of uses in the convention: medical, industrial, and abuse. None of them is really defined. Everybody just said, we understand what it means, but we don't. So my interpretation is that, adult use might very well fall under industrial use. We are talking about cannabis industries. So in that case, adult use is exempt from the convention. And that sort of makes sense because these conventions are here to control drugs, to control medicines. They're not here to control hemp or industrial use or, whatever industrial product is made, or adult use as well. They are just not fit. If you look at the provision of the treaty, they talk about prescription, they talk about, specifications, specific disposition for pharmacists, physicians. This just does not relate to adult use. It relates to medical
Yeah.
use. So a lot of interpretation. And if you hear people say, this is international drug law clearly says that, it's probably a lie, because international drug law is everything but clear. So
I love it. I love it. As a lawyer, I can appreciate the vagueness. So it's good to have that summary. Thank you, Kenzi. Cool. Okay. Well, let's get on to the juicy bit. What has happened in the last couple of weeks at the UN level in relation to this?
Well, cannabis was and still is actually scheduled in a very strange way in the conventions. So the first thing maybe to understand is that the schedules in the US are very different from the schedules in the treaties. Same thing, the schedule in the UK and in the US are different. They have ABC, you have 1, 2, 3, 4, etc. In the UN, the conventions, it's numbers, but it's the way around. Schedule 4 is the highest. It's equivalent to Schedule 1 in the US scheduling system. So it's also made to be just to confuse. But Schedule 4 is the highest level of control. And interestingly, it's a schedule that is not really, usually a schedule is a list where you have certain drugs, and with the drugs that are in this list are subject to a particular set of legal measures of control, right? Schedule 4 is not that. There is no specific measure of control attached to Schedule 4. It's really a political, a symbolical schedule, and it was created for that. When they discussed the convention, they were hesitating in the 1960s between making actually a treaty to prohibit drugs or a treaty to control drugs. The idea was either a treaty to prohibit drugs with some exception for medical use, or a treaty that controls medical use, and then maybe give rise to possibly prohibiting the other uses. And they opted for that second option. The USA defended a treaty of prohibition, and in the first draft of the convention proposed by the USA, it was a list of prohibited substances, and cannabis was in. Actually, there was an article which was named Prohibition of Cannabis in the first draft of the convention proposed by Anslinger, US representative. That changed. A lot of countries were opposed to that. The UK, France, Burma, Pakistan, India. So many countries were actually opposed to that, not only because they were saying, well, look, we do use it in medicine, so give us some room to continue using it, at least in medicine. And some other were just saying, you're not going to impose prohibition. We have sovereignty. Even though we agree that it's a dangerous drug, we want to keep room for sovereignty. So the mandatory prohibition of cannabis was abandoned, but instead they passed this symbolic schedule, which in its description contains the word prohibition, but it's not a mandatory prohibition. It's an optional prohibition. So that's why many people call it the schedule of the prohibition schedule. It's very symbolical. They placed heroin, cannabis, and a couple of substances like that in the list. After some years, they placed fentanyl and other very dangerous substances. So it's really a symbol more than a particular set of policy controls. So taking cannabis out of that symbolic Schedule 4 was particularly important because it's internationally, that's how things work, sometimes more with symbols than with particular dispositions, or at least the symbol is a precursor of what's going to come after. But also because it was placed here as a symbol. When the UN placed cannabis in this list, it was known that it was used in medicine. It was known that it was used by many communities for non-medical uses, traditional medical uses. And they explicitly said, we are going to go together towards the abolition of these practices. So instead of prohibition, they said, let's make a gradual discontinuation of the use of cannabis in medicine, outside of medicine, etc. So there were transitional provisions to reach this gradual disappearance of cannabis use, and that just didn't happen. So the symbol is important. And what's even more important is that it's not governments, it's not Canada and Uruguay and the Netherlands getting together and taking cannabis out of Schedule 4. It's a 3-year comprehensive review by independent experts convened. It's not the WHO, it's independent experts from all around the world convened by WHO. So they are even independent from WHO itself, So really a bunch of high-level experts that are certainly not cannabis activists that got together for 3 years, made a series of comprehensive assessments, taking into account every information they could, and saying after that, not only you have to take cannabis out of Schedule 4, but what they said also is cannabis is less dangerous than substances in Schedule 1. So Schedule 1, which is the basic level of control for drugs in the 61 Convention, which is where cannabis will remain after being withdrawn from Schedule 4. The problem is that cannabis is one of the pillars of the 61 Convention. So you taking cannabis out of Schedule 1, you would need to sort of amend also the treaty, and you will need to do a series of other changes that WHO cannot really pass. They can just, they have a very limited mandate, as I was saying before. So they could not recommend taking cannabis out of Schedule 1. Or they could do it, but there was no chance of passing at all. But they could declare that cannabis is by far less dangerous than substances in Schedule 1. And that's unprecedented, and that's absolutely critical.
That's brilliant, Kenzi. Thank you so much. Really amazing context there to really understand that, and actually encouraging, because often experts aren't listened to in this arena in drugs policy. So it's encouraging that at least once they were, and I'm sure there's still lots of challenges to face, but the WHO actually made a few different recommendations, didn't they? And this was the only one that was passed. What were the other ones that were on the table?
The other ones are really complex, but it was, as I said earlier, we have cannabis resin and extract and tinctures of cannabis scheduled in the 1961 Convention on Narcotic Drugs. And in the other, the 71 on psychotropic substances, we have THC. And we have Delta 9 THC in one schedule. And then we have Delta 6 and Delta 8 and the other isomers in other schedule, which is just make really no sense. If you look at the two conventions and you list all of the entries for cannabis products, you realize there were a total of 8 entries for cannabis products, where, you usually have one or two. You usually have two. For instance, opium and morphine. One for the, herbal product, and then one for the main psychoactive compound, that is considered a drug. Opium and morphine, we should have had just, cannabis buds and THC. But no, instead of that, we had 8 different entities: cannabis resin, cannabis extracts, cannabis tinctures, cannabis preparations, THC, preparation of THC. So just extremely complex for no reason. And that obviously makes also complexities in real life. Instead of filling in one form, you have to fill in 2 forms, or you have to understand whether you have to fill the 1961 or the 1971 form, etc., etc. So it's obviously sometimes even more complex than that, but that's really not the way to go for policy coherence and, for whatever, just for logic, for basic logic and reasoning. So the recommendation of the WHO mostly were at this goal to simplify drug control without really, in a way that could pass for the countries that oppose, loosening control over cannabis. They propose to just sort of move horizontally the different substances so that they could, in the end, be all scheduled at the same place. And even though we have so many entries for cannabis, at least they all fall under the same control. So that makes sense. Unfortunately, that was not adopted. Maybe one of the reasons is that also in this recommendation, what WHO was proposing, and that has not been noted by in particular cannabis communities, which should have defended that, WHO recommended to even the playing field for synthetic cannabis medicine and plant-derived cannabis medicines. At the moment, before the vote, and because these recommendations were rejected, it's still the case, what we call a preparation of synthetic THC, so for instance, Marinol, is less controlled or subject to less strict controls than a preparation of plant-derived THC, which could be Sativex or just, a bud is de facto a preparation of, plant-derived THC. For instance, a Bedrocan is buds prepared, harmonized pharmaceutically, sold in pharmacies. It's a preparation of plant-derived THC, but it's controlled at the more strict level in international law. So WHO, by making these moves, these technical moves, and bringing all the different entries for cannabis products or cannabinoids in the same schedule, the effect, the concrete effect that would have had would have been to equalize the level of control, for instance, marinol and a traditional Ayurvedic preparation.
Wow, that's really useful as well, that synthetic versus natural. And you can't help but think that it suits some commercial interests for that distinction to remain.
Well, in the US in particular, if you look at the votes, the USA, and if you look at the explanation of votes, I mean, the USA didn't make a public explanation of votes on why they oppose these particular recommendations. But in the explanation that they made in, the diplomatic discussions to which only civil society observers have access, the job that they've been doing, you have to be there and follow, etc., etc. They were clearly saying we oppose that because it would just not suit our industrial interests. We have a pharmaceutical industry already developed making these medicines, and we want them to, continue being at advantage. I guess they didn't say it that way, and I won't, blame them. That sort of makes sense. What is more concerning is for other countries that voted against and, that do not have this kind of industry. So at least for the USA, maybe it's a Machiavellic way of of voting, but at least you can sort of find reason in it. Some other countries just, oppose for opposing. Which is not...
Yeah. Follow the money, right? Sadly, very predictable, but and ultimately prioritizing the interest of companies and shareholders over the general public. But that's another story. Yeah. You've given us a great overview, really good. It's a really difficult area, so I really do appreciate you kind of simplifying it for us. What do you think are the main implications of the vote then? Because as you talked about at the top of this piece, it's very symbolic rather than actually kind of really unlocking anything on a practical level. But where do you see it going from here?
Well, it's symbolic, but it's the most powerful symbol that we have seen in drug policy so far, and that we will see in the next decades. I mean, there is no more powerful symbol in this arena. So it's a huge symbol, and that will not be just symbolic. It will have actual effects. It's just that when we say it's symbolic, we want to mean that it's not a decision that will force countries to regulate cannabis. You know what I mean? There is no mandatory obligation deriving from them. But there is a moral and ethical obligation. The Commission on Narcotic Drugs, this commission of the UN that voted and that, rejected everything but adopted this symbolic step, it's known for being extremely conservative commission, and, they always, and very slow, etc., etc. Once this commission has taken the step to take cannabis out of Schedule 4, which means recognizing its not only its value in medicine, but its legitimacy in being used in clinical practice, continuing to, forbid the medical use of cannabis is being more conservative than, many countries that are many dictatorships and countries that are extremely old school that form this commission and that still have accepted that. But that's not just, comparison with the Commission on Narcotic Drugs. Countries, governments are going to receive circular letter, an official communication from the Secretary General of the United Nations, telling them, listen, this is what we have done. We have withdrawn cannabis from Schedule 4. This is what happens. Cannabis is no longer in Schedule 4, and we inform you. In some countries, for instance, in Spain, if you look at the law, the Controlled Substances Act of Spain, basically, instead of saying, so we are going to have Schedule A, Schedule B2, whatever, they directly refer to the schedules of the conventions. So the schedules of the national drug law in Spain are directly the schedule of the convention. So once the Spanish government receives the notification, not only it's, informative and they discover international scheduling has changed, but it's also a notification that the actual Spanish law will have changed as well, unless the government take action to revert it or something that can. But that's an action of the government against medical cannabis, and going in a position that is more conservative than the Commission on Narcotic Drugs. So that's really a step that it is hard politically to take, even for very conservative governments. So it's really going to make if people in every country are able to use the momentum and to play with it and to keep attentive at what moment will the letter arrive and how will the government react, it can be a shockwave globally that will have very concrete, very quick impacts on facilitating the access to medical cannabis.
Brilliant. I think that is something to look forward to, and hopefully people like yourselves are doing some amazing work in various countries to sort of capitalize on this positive movement. So just before we finish up, I guess, there are different approaches to this amongst countries across the world. Who are some of the more pro-cannabis countries and who are some of the most anti? I understand Russia has been quite resistant to change in this area. Can you name names?
Name names. Yeah, Russia has been definitely pushing very hard, and especially they put their diplomatic power and experience, which is non-negligible, to the service of opposing these recommendations. So they have been employing really, really fine, complex, long-term strategies, diplomatic strategies, geopolitical strategies to go against this recommendation. And these strategies have been really, really, really effective. I've been just witnessing that. Russia is probably the main country responsible for this failure, because not only it has deployed this strategy inside of the UN, but it has also used outside of the UN all possible ties with countries and all possible ways to pressure countries to obtain an alliance of countries opposing the recommendation. And that's something that didn't happen on the other side. There were many countries supporting the recommendations, but they didn't manage to have a common voice or to get along, or to at least get a smaller common denominator statement or something like that, saying at least we support science, at least we support the Schedule 4 recommendation. Many countries were supporting it, but didn't manage to play on it and to have their voices properly heard. Russia did. And it's fair to say that many countries have stayed behind Russia. Even countries like China have very much just taken the floor to add a couple of comments, but often we're just aligning with the position of Russia. But other countries have really put effort against this recommendation, in particular Pakistan and Nigeria. I think Turkey also has been really annoying. I don't see other word. I'm sorry for the lack of diplomacy, but they have really been annoying, in particular using arguments that just do not make sense, or that likely prove their ignorance of what the plant is. For instance, they've been explaining that cultivating cannabis for medical purposes goes against food security, because it's land that we could have cultivated for food, and instead we cultivate it for medicine, and therefore we have less food available, which is just stupid when you consider that cannabis is a food producing plant. It's a plant with which you can also produce food, and you can also have multiple harvests on one crop, including food and cannabinoids. So yeah, Russia, Nigeria, Pakistan, and Turkey, unfortunately. And on the side of countries supporting the recommendation, we have had two countries that since the beginning three countries have voiced strong support: Switzerland, South Africa, and Jamaica. And for us, that's great, because it's three small countries, except South Africa, but Switzerland and Jamaica are quite small, but they are central in their continent, and they have some place and some role to play that is non-negligible, in particular Switzerland, but Jamaica as well within the Caribbean community. And then we got many other countries voting in favor of all recommendations, such as Australia, Ecuador. Some countries had reservation on a couple of recommendations for technical reasons, like Colombia or many Latin American countries. But or the European Union. The European Union has had a very good position, very positive, supporting almost every recommendations.
Brilliant. I mean, we could go into a lot more there, and I'd quite like to know why Russia is so anti, but I expect that's going to be quite a big answer, and I'm conscious of time. So let's pause there. Perhaps we can get you on again to talk about that or other aspects. Listen, Kenzi, this has been brilliant, super interesting, and answered a lot of questions that I had wanted to ask, but also I've had a lot of texts and messages this week to sort of ask me about what the consequences are. So hopefully this will bring light to it.
Well, if I can maybe close with something related to the US in particular, but I mean, you have the MORE Act currently unfolding, let's say, let's see where it's going. But in case, in the case that the MORE Act couldn't pass, this withdrawal from Schedule 4 will probably take even more importance in the US, because I believe that the Attorney General would have to take action upon reception of the letter and eventually consider if a change in scheduling in the US, would be needed to reflect the change in scheduling in the UN. So in case the MORE Act doesn't pass, this Secretary General letter would be a big hope, I guess, for the cannabis policy reform in the US.
Fingers crossed.
Yep.
Fingers crossed. Cool.
Indeed.
Well, thank you, Kenzi, for joining us, and I look forward to hearing more from you in the future.
Pleasure to get back here. I hope, we won't have good news like that every 5 years or not even every, decade. So I'm not sure I will have the opportunity to get back on the show for such a great news and such a complex issue as well. But this is also opening a lot of doors, in particular doors towards, adopting a more sustainable approach to cannabis policies. And I guess we will have to discuss that at some point.
For sure. Thanks, Kenzi.
You're welcome.
Thanks for joining me for that episode. I thought that was really great and a really great and fitting way to end this year. It's a really complex area, but Kenzi was brilliant at breaking it down for us and explaining the machinations involved in international drug law. In relation to that, I would also like to ask a favour of you all. Kenzi has been working on drug policy reform for many years now, virtually unfunded, and it's in part due to his hard work alongside his colleagues that we finally have some movement at the UN level. So if you're a keen supporter of this industry, it's down to people like Kenzi that it's now opening up. So I'd like to ask you to join me in signing up to his Patreon page just to give him a little to help support him and his fine work. I'll be providing links on my LinkedIn post, so please do check it out. I thank you all in advance for those that do contribute. And that just leaves me to say, have a lovely end of year and a nice break. And here's looking forward to a much better 2021. Cheers.